where entrepreneurs align.
Alliances where entrepreneurs align.
Alliances where entrepreneurs align.
Alliances where entrepreneurs align.
Alliances where entrepreneurs align.
Welcome to Eliances, the only place where entrepreneurs align.
All right, so welcome back to the show. Again, we've got so much going on, and I can't thank you enough for when I interviewed the co-founder of Zillow. So make sure that you go to Eliances.com. That's Eliances.com. It is the only place where entrepreneurs align. All right, so we're going to welcome Dr. Sarah Liu to the show. She is U.S. Republican senatorial candidate, and you can reach her at drsarahliuforcongress.com. And of course, we have it at the bottom here of the website. Dr. Liu, you're running for U.S. Republican senatorial candidate, and we're so excited to welcome you back to the show. There is a lot of things that people want to know so that they know who to vote for. Will you please discuss medical insurance and the insurance system in the United States, please?
Thank you for inviting me here. Nice to meet you. Thank you for your supporting for entrepreneur. So today's America is so problem there because we pay a higher medical expense, but we don't get enough insurance benefits. That's the one is number one. I wanna talk. As well as the system is not available. Each individual medical, like one doctor's, another doctor's. Examples, if we go to the medical, like one doctor's, we already tested the blood test. But if we go to the another doctor's, they don't really access those another doctor's those records. So we have to have a spending another, examinations. Those because those system needed to convert each other, but our today's medical system is not convert each location. So, and the third problem is we don't need really disclosure to we do not disclose those medical cost, because I have experience. I went to Texas. I have catch a cold. I go to the local general hospital. And then I asking doctor, what is my cost? What is my cost to pay for those your treatment? And doctor said to me that, don't worry, we treat you and we'll send you bill. So once I come back to travel, I got the bill is $199 because of those fees. I can go just pharmacy and get a simple treatment, but I pay $199. So after that, I think about we should do disclosure to every patient to get the before they treat. We should get those treatment cost. We have to have it. So we have another problem is medical is privatized, because those medical insurance medical system is we are income plus health conditions. That's why is we have a 15 percentage of America, they don't have insurance. So that is another our problem. Another problem is Obamacare. So because those medical health privatized brings many problem, because many people they don't want to enroll insurance. That's why 15% no insurance in the American peoples. That's caused to make more deaths. People that's only because they cannot go to the hospital. They cannot pay those expenses. So those problem try to solve it to Obamacare, but the Obamacare problem is there is they don't give it to private. They should have every person have to be enrolled. There is no personal decision. As well as we get if we not enrolled, those we have a big penalty. And then as well as the Obamacare's problem is government debt is 176 trillion debits because of those subsidies to pay for the curb of those Obama insurance. We have so many as well as those all the transaction fees cost is a lot to take care of those medical insurance. So we have to really think about those problems. I have my policy was a medical policies. I wanted to have a national health insurance program, which is every person's automatically enroll in the program, and then implied natural designation systems, which is no age, no incomes, no health conditions, just everyone's we national health insurance program, which is Korean. They had already successful number one best insurance, best healthcare in Korea. So I have experience. 2011 I went to Korea, and then I was very surprised because I only pay like $20. I got all the examination, all the things because I have to pay $250. In America, I only pay 20. So this is a Korean national health insurance programs. They only pay by incomes. Whatever the incomes, those percentages they pay as well as equal, coverage. So, in America, they pay more, they have more coverage and less pays, less coverage. That's why many people, they don't have enough coverage because they only endorse whatever they do. But in Korea, the health system is a national health insurance program that is no age, just only by the incomes. Every health conditions, whatever they have cancer, what kind of any health condition, they have equal treat. I think that is the best way we can solve our America's high insurance fee, less service. And also, Korea, also there is systems. We have to really national those systems able to each patient levels. Like example homeless. We have some sample in the Houston homeless service those program, which is the homeless coming and they coming to emergency and they can know about this homeless social workers, this homeless where they treated. What kind of treated they need 9 hours, they don't need. So those are like one successful example we have. We can using those system to individual people, their record, medical record, even go to the A, B, C, D, different hospital they go. They needed to know, like they went like yesterday is A hospital, they take a blood test and they go to the B hospital and they needed to know already they have all record access to A hospital one and they don't need to duplicate service, but now it's America duplicates the service. If I go to Senate, are we going to work harder to do the system build it, then we can save a lot of insurance cost, we can save a lot of medical cost able to, as well as the second, my policy is implementable, policy needed because now Obamacare and then medical privatize those America plan is not employer liable every persons, only richest persons, only big corporations, only person who has. So my policy is we need to fix like a corporation, like Obamacare, every corporation have to have it a minimum insurance. If they don't get the minimum insurance for their employees, they have lots of penalties. So those corporation cost is higher, and then with the higher medical expense, higher transaction cost. This is really not employable to people to follow those Obamacare, those medical privatized. That's why it's 15% America no insurance today. So are we going to fix those problems that we have to have a policy, collect policy that can able to employ people, and then also target service. If we pay the higher medical service or higher insurance fee, so we are not really get the benefit because we don't have a target service plans. We have to have a target service plan, which we need the level of conditions, level of age, level of income. we need to really verify those feasible plans, target service. If someone, even they pay insurance 10 years, they don't need to go to the hospital. They wasting all those insurance fee. That is, we did not target service. Maybe those people, we just charge a small insurance fee. Also, elder, who are cancers, they have their target service is more like need visible for those cancer treatment, but our insurance really, not really target service. So if I go to sanitary, I'm going to make those target service available. And then we have to really follow those one sample examine successful sample we needed to follow, like Korea National Health Insurance problem is really, their success because every person, they have it doesn't matter age, it doesn't matter, just only by incomes they pay, but they got the all health condition is really cost transactions. No debt for government. Our government had 1.76 3 billion deaths, because since 2013 to 2023, 10 years, during those 10 years, we have 176 trillion deaths. So corporations burden, now COVID-19, still those law is applied, so corporation is cost is too much. We have to reduce those corporation burden because of a medical system. So we have to really helping business to learning less cost, but those medical insurance subsidize is, we have a make burden to government as well as, business owners is burden, yeah.
What about as far as with the small businesses in regards to healthcare and that? So you mentioned about large businesses and that. How can entrepreneurs, solopreneurs, and small businesses, what's your plan for them regarding health insurance?
Okay, so many America right now depend on the only corporations, and the only individuals, personalized or Obamacares who or Medicares. So, but really, the government is so dependent on the business develop economic growth, but the all burden is a corporation's cost. So we have to really, those corporations had all those choice to have insurance that implyable policy, because we did not do individual level corporations insurance plans. So most all corporations, there is a big tax, there is a small business, there is even only personal persons learning those business, but there are all the medical policy, medical plan is not really difference. So we have to have it those like one person self-employer insurance and small 20 more people's corporations insurance cost and plan, and also big tech cost is just have to be little bit a little bit different, but there is not that much difference as plan. So we have to really nationalize has insurance program, not only personalized corporations and individuals that needed to support by government, more government subsidize that needed to support those the corporations to save those costs. Then most right now is subsidized. We are spending for the Obamacare and the Medicare, but we are not really those subsidized using for supporting corporations. We have to really, that's why the more poor people get those all the subsidized, which is like Medicare, and then Obama, those we are targeting only for the who does not able to get those insurance. But those corporation is next level, because those corporations had money, they are running business, they cover those insurance for employee. That's why it's that's the different story, that we have to have a really implementable policy for the corporation separately, and then, more burden to the business owner. We have to really cut the price of insurance, and we have the target service to those corporations feasible to a level of service, and then so we have to really reform those corporations to who are big tech and small corporation and personal, own the business. We have to really separate plans. We have to do, yeah.
I find it very interesting, again, where you mention about Korea and taking the parts and things that work within the Korea health system and bringing it to the United States. I don't think anybody's ever done that before or even knowledgeable of it like you are. And again, we're talking with Dr. Sarah Liu, U.S. Republican senatorial candidate. You could reach her at drsarahliuforcongress.com. And of course, too, as you'll see at the bottom of the link. So talk to us about the aspect now of bringing what you mentioned about the parts of what works in Korea to the United States, because you've seen it, it works there, and talk about just the aspect of being able to implement it within the United States.
Okay, so United States is, we have those differentiations. United States is insurance and medical system all personalized, which is very personalized, means depends on their age, depends on their incomes, depends on their health condition, from, to a very small amount insurance to all the way higher. So my examples, my one of friend, he paid like $3,000 a year insurance, 10 years, but he never go to the hospital, wasting all the money because he has because he thought that he needed those plan. But in Korea, those money is wasting because he never go to the 10 years hospital, even he paid. Because also in less price, those people who are Obamacare, they have to, even they don't go to the hospital, they have to pay in order to avoid the penalty. No, personal decisions, and then also government to pay all those subsidies cover those Obama and 1.76 trillion deaths between 2013 and 2023. But Korea is a different story. Korea is not medical properties. They care of income, but they, whatever their income, like whatever has $1,000 income, they pay percentage of those incomes they pay. And if you have a $10,000 income, they pay whatever those incomes. They have example 1%. So, and then once they have cancer, like they have a liver cancer, in America, they have to have another plan join. And then if they don't have a cancer, insurance plan, what happened? They have to have another lots, cost they have to pay. But in Korea, it's automatically they are enrolled all the cancer programs, employment, the nature designation systems that able to every person who are already enrolled automatically in their system. Once they have cancer, they go to the hospital, they already covered every cancer. They already everything. So they don't have to pay any money for extra money. That only little bit money only they pay, that they can just treat the same richest person or same poor person, same hospital they go, same doctors they go, they pay same price. But in America, we have cancer. We have to have our own doctors, but those own doctors have to be approved. Those another doctors who are cancer treatment, those transaction fees, high cost, as well as that is all the insurance burden. The government is pay those transaction. They very, complex, and then another cancer, another place, many multiple, doctors organization have to be treat those cancer, as well as, they have to pay a lot of money those treat cancer. But in Korea, it's different. In Korea, they don't have to pay that much because already national health insurance program already that is automatically all the people is automatically already enrolled, so they don't have to worry about I did not have cancer insurance. oh my God, I have to join right now. And then once we did not have a cancer insurance in America, they have to pay those original, all the cost, higher cost, 20,000, 30,000 surgery fee. In Korea, different. They already automatically enroll. They don't worry about those cancer treatment, lumps of money, 20,000, 30,000. They just already take care of those, government subsidized money. And as well as they have a personal, like insurance company, they care all the those people's insurance. Once they have cancer, not the government subsidize only. Those personal insurance working with those government, they pay for almost up to 50%, 80% cancer fees. They pay for those personal insurance agents working need those government already, because those insurance company and national health insurance program implied together already when they have cancer. This is really good news to if we can bring those systems in America. America has reached the country, but we still have after Obama cares, we have so disadvantage those try to Obama, those insurance we have all people's had a doctors. Problem is all people does not have really less medical treatment. But in Korea, those systems, we have to focus on that, not just what Obama take care of those all doctors have it. But we have all doctors, but problem is we have to pay more money transaction fees, more money to those Obama, cares had, those good things to poor people has insurance, but still they don't have no personal decision need a penalty. We have a lot of penalty, 2% to penalty. Who does not endure Obama, as well as a penalty. Corporation those had a penalty because of those medical insurance is too high. But in Korea, automatically endure by their no age, just income, by incomes, they already take care of, once they have those medical treat needed. So we needed to really reform those system. Our problem in a high insurance fee, less service system is not really connection each others and no disclosure medical, before treat. And then also we have to reform Obamacare too. Is we have to have our own personal decision as well as no penalty, but we have no personal decision, and also we have so many penalty. People, they don't have 15% no insurance to die early because they cannot go to the surgery, $20,000 they cannot pay. Their family is like weeping. Their family is burdened because of they cannot send their family member to go to the hospital. But in Korea, it's different. They have already had systems. They have already everything is done. So I'm really working hard to bring those good models. I'm Korean American. I already had 2-3 times Korean benefits. So my when I was went to the Korea, my mom is two months is a hospital because he had a knee surgery, but because optional knee surgery, she does not pay that much. I'm a member of family. Is we don't pay that much money, but in America we have a surgery, knee surgery like my mom did. Our family is burdened and really. Have a lot of pay to insurance. After surgery, we have to pay 20 years. Even, we are burdened those fee because of we have to pay. So this is America, the insurance problem. So, yeah.
Unbelievable. And again, it's amazing of what you can do and why people need to vote for you. And I'm looking forward to the next interview where we're going to be talking about many other issues, women's right to choose and right to bear arms and all that. So make sure that you stay tuned. Thank you again to Dr. Sarah Liu, U.S. Republican senatorial candidate. Make sure that you go to our website, DrSarahLiuForCongress.com, DrSarahLiuForCongress.com. This has been David Kogan with the Eliances Hero Show. Thank you again, Dr. Sarah.
Thank you for inviting me. Thank you for supporting.